So the next big area that we want to talk about is smack dab on top of Medicare Advantage, Part C.
Yeah, so obviously we're all watching the Dr. Oz situation and if he'll be finalized as the nominee. And it does seem like things are moving that direction. And so we want to think about what is his track record and what has he said about MA, and not just in the hearing, because that's a little bit political in terms of what you say to get confirmed, but thinking about his record before that. And we know that he has written in 2020, when there's all that Medicare for all discussion going on about Medicare Advantage for all, and he kind of suggested, let's just pull everyone who's not in Medicaid onto Medicare Advantage, right? That's a really extreme opinion. I don't think he's gonna go that direction. Obviously, fee-for-service Medicare is important, and trying to get rid of ESI is basically unimaginable in this country. But it is a signal that he thinks very strongly about Medicare Advantage and the way the payment system works. It can be potentially more efficient than a fee-for-service piecemeal system. We also know that the Republicans in general have a little bit more of a free market leaning inclination. And so that would tend to suggest that Medicare Advantage might continue to win out in terms of market share relative to traditional Medicare. At the same time, we see this administration really focused on scaling back costs and thinking about efficiency. And we know that the federal government pays more, about 20%, according to the MedPAC analysis, per an MA enrollee relative to a traditional enrollee. And that ends up driving up the Part B premiums for both traditional and MA. And so there's been some discussion in the past about kind of changing how that funding structure works, and maybe that would take hold. So even though Medicare Advantage is probably in a good position to grow, it's also likely going to change. And so that'll be interesting to see what happens. Obviously, in November of last year, there was a big proposed rule that had a whole range of changes, everything from weight loss drugs to what is considered marketing. And then it'll be interesting to see what happens. The current administration has kind of put pause on some final rules, and so maybe some of that will get paused too. But in the areas where transparency and kind of, clearer marketing practices, maybe that does go forward. But also, if you cut how many people are working for HHS, then maybe that's a challenge, right? So there's a lot of tension here, and I don't think it's really clear what's going to win out.
Yeah, I think so. For us, one of the big headlines has been that Medicare Advantage costs 20% more, and I think that's a statistic that still needs to be proven out. If you look at the research from 3 or 4 years ago, we were way more cost effective than just a fee-for-service model. So we've analyzed that a lot and worked with our actuaries and just kind of thought through what that looks like. And one of the opinions that's come out is that's really due to this pent-up demand from COVID, because they're looking at data from 2 or 3 years ago. And that was when COVID was finally over. Everyone started going back to the doctor. We had huge spikes in medical cost. So that's part of the trend, I think, and I think time will eventually tell and see if that was what's driving it. But just in general, if it does end up that Medicare Advantage is a little more expensive than fee-for-service, the health outcomes are at least 45% better than what you see in a fee-for-service model. It's a managed care model. Obviously, we work closely, especially a plan like mine, we work very closely with providers around value-based care, incentivizing them to keep the members healthy, them to keep the members out of the hospital. So I think that's important to remember, as you guys are going to hear some of that in the market as you start to go out and sell. I mean, most Medicare Advantage companies do managed care very well, and our health outcomes are way surpass any potential downside from a financial standpoint.
Yeah, just on that MedPAC study, I think that was one of my questions too, and if anyone knows, please let me know later. But it's comparing those Medicare Advantage people to if they were on traditional Medicare, but is that and have a Medigap plan, right? I think one of the big advantages of Medicare Advantage relative to standalone traditional Medicare is you're getting more risk protection with the out-of-pocket maxes and things like that. So I think that needs to be clarified when we're thinking about the relative cost.
Yeah, no, I agree. I mean, obviously, supplemental benefits play a factor into that. So, yeah, I agree.
Yeah, you know, one thing that when I was kind of reading through that MedPAC piece, and, you know, agent commission is always a piece that, you know, we're looked at, right, in DC. And I just wonder if, you know, they're comparing what an agent makes on a Medicare Advantage sell versus what an agent makes on a Med Sup sell. But what they forgot to include in there was we don't sell a Med Sup without a PDP, right? We always make sure that we take care of, you know, a client, you know's full drug and health plan. So add that PDP commission in there, and you're about even. You know, on what that is. So is there really a upside to selling a Med Advantage or a Med Supplement plan with a prescription drug plan? You know, there's not. We as agents, we go in and we do what's best for the client, and we look at, you know, all of their options. And, you know, a traditional Medicare with, you know, with the Med Sup plan is definitely an option. I was in a study group last week, and we were talking about, you know, Dr. Oz and you know, a proponent of MA, and, you know, it's come out that he has an agency of his own. So he runs and owns his own agency. And so I would say yes, he definitely is, you know, a proponent for MA, and we'll see if he has to step down as the owner of that agency or what you know, what happens there. And then, you know, you look at RFK, you know, who also has come in, and he himself is on an MA plan, you know. So I definitely think there's support. I love the fact that Dr. Oz has taken AHIP certification and taken all the certifications, has gone through the licensing and appointment, you know, phase of being an agent himself, because he understands what we go through. We're a part of a lot of associations, industry associations like NABIP and HAFA and NAFA. And we're trying to get appointments, you know, on the Hill. These groups, we're stepping in and we're wanting to get in front of, you know, Dr. Oz, and we'll see if RFK or whoever wants to talk to us. But it's important for us to advocate, you know, for our industry and for MA, because regardless of what you guys are going to battle out, how expensive it's going to be, it's definitely here to stay. And we want, you know, good plans to be able to, you know, take into the consumer's house.
Yeah, I think once the shock and awe of factor of Dr. Oz being the nominee got over, we actually started researching, and I was surprised and pleasantly surprised that he is such a advocate for MA. I don't think he's going to be able to push 100% into MA. I don't see that happening. That would be very difficult, and, you know, obviously change the structure of the entire industry. So, but I do think that he's probably going to try and level the playing field a little, which is concerning as a plan, and probably would be concerning a little bit from an agent standpoint. I think he's probably going to put caps on certain benefits where it's going to lower the competition from a plan design. So, but I guess we'll see in the next few days.
And then just another piece that I didn't talk on was the new proposed rule that's out there. Obviously, we did get a win with the recent CMS call letter where clients don't have to call 1-800-MEDICARE to get enrolled into, you know, an SEP. So that was a huge win. That's part of what, you know, our associations do, is, you know, push from that way. One piece that we're still looking at, and I don't know if we're going to see it go through, but it's this marketing piece. So they're trying to say that all your marketing pieces have to go through CMS to get approved. How they've cut so many people, how are they going to actually handle that volume? We're really advocating that, you know, let us FMOs be that person. Let us have our compliance department and, you know, help you make sure that you're marketing compliantly.
Oh, they market, but we have to have everything go through them, and I can tell you, depends on who's actually reviewing it, because some people get approved for certain marketing materials and other plans don't. So that it would be interesting, especially after the cuts.
I think too, in that proposed rule, there's so much we didn't really dive in deep, but I think another one that's worth thinking about when we're thinking about that balance between MA and then traditional Medicare is this idea of agents needing to educate their enrollees about the fact that if they leave MA and try to go back and get a Medicare supplement, that there's going to be medical underwriting and they might not. And that should be known, right? But kind of just the regulation enforcement of that, that can take up time.
Yeah, really good point.
Yeah, and it strikes me that the first three topics that we've talked about, if you take them as a whole, it seems that Dr. Oz is going to be kind of the thought leader behind this, right? It's not something that it's evident that President Trump is really focused on. It's not something that it seems Secretary Kennedy is focused on, and Oz has these two very conflicting fundamental ideas of more marketplace, more market competition, but also more control and transparency and leveling the playing field. And exactly how that plays out, I'm not sure. But as a technology provider, we view our role in this is we need to prepare you to be able to be agile. Because as these things shift, you need to be looking at your sales data every day during annual enrollment and understanding what's going on and what factors are shifting, because I think it's 60% now are on MA. It could jump dramatically or it could reduce a little bit, this AEP, and somewhere in between, and we just don't know. So having the agility and having the visibility into what's happening, again, as a technology provider, we think that's what we can do to help you guys be successful.